and welcome to Behind the Scenes Self-Help Voices. I'm your host today, Katie Foley, and I'm thrilled that you've joined us to listen to Deneisha White, who is a nurse and has worked in the community and has worked with self-help for quite a while now. And we are very honored to have her here and learn a little bit more about her. So Deneisha, do you want to say hello and introduce yourself?
Yes. Hi, Katie. Thank you so much for having me. I am excited to be on the podcast. My name is Deneisha White, and I am the Director of Clinical Services for Business Development, and I work with the Licensed Home Care Service Agency here at Selfhelp. I've been here at Selfhelp for 4 years, I believe. The first day the city closed down was my first day that I started, and that was March 23rd, 2020.
What initially brought you to self-help?
Well, what interests me about self-help was their mission. The mission aligned with some of what, with I guess my mission or what I would love to do and what I'd like my life's work to be about. And that's really helping others, helping specifically the elderly. I came to self-help because I want to help others, which what self-help has done for over 85 years, and be the last surviving relative, if I can be that, because being that everyone needs someone and not everyone has somebody, especially as we get to a certain age. And here at Self-Help, we spend so much time in the community with our clients and patients that we are now quote unquote family, and we might be the last surviving relatives that they have, because everyone else is all over the world, or there's no relationship there. So we try to build or bring those people to the person's life or patient or a client's life to restore whatever was missing while we help them to mend, but also ensuring that they live to their last with dignity, and the dignity is the big part of it, and respect. So I think that's the reason why I'm here at Self-Help, really.
I'm so inspired about how you've been motivated by our mission. And our mission specifically calls out being the last surviving relative for Holocaust survivors. But you see your work so deeply in the community and with others that being the last surviving relative extends to any person who needs it. And like you said, I love what you just said about everyone needs someone. And that's absolutely true. We need to live in community, in family, in connection with others. And you want to be that person who is there for them until the very end, caring for them, helping them live with dignity, and really embodying that mission to any person who needs it, which is so beautiful. You are a nurse. Why did you become a nurse?
Yeah, I became a nurse because there was a few events that happened in my personal life. I was a fashion designer before. I wanted to help others. I wanted to be of service to others. And I realized that I could do that. I started my path towards being a registered nurse, which is a completely different career path for me. And I made it through. Let me tell you, it's one of the hardest professions you'll ever do. Even schooling. And I was successful with that. And that's the reason I became a nurse, to help others. The reason I stayed a nurse is because, and specifically in home care, which is my specialty in my field, is because that's where I see people needs the help. If I'm going to help others, where can most of my efforts go towards helping and making the difference? And of course, I wanted to make a difference. All I have to do is to reach that one person or help that one person with something that required, that they need help with. It gives me a sense of satisfaction, and that I can pat myself on the back and say, you did a good job. Mind you, I never do anything by myself. It's a consistent teamwork. And with everything that we do as nurses in healthcare as a health team, there's no one person. It's always a multidisciplinary approach. And that's why I like the program that I am a part of now. I think we could segue into that.
Yeah, let's talk about that. In your current role, you go into the community, you help people stay healthy, you help them follow the doctor's orders by staying on their medication, eating right, making sure they get to their doctor's appointments, checking in on them so that they're not isolated, that they understand the doctor's orders, right? Sometimes it's complicated how to take the medication or how to stay healthy, and you help them do all of those things. I'm curious, what is a typical day in the life for you like in this new role?
I worked with a team, LPN, social worker, and care managers, collaborate with other members that would be a part of the clients. We work with everyone that's a part of their care team. So that would be the physicians, MDs, medical doctors, or NPs or nurse practitioners. Everyone really participates in this clients or their patients. And at the LICSA, Licensed Home Care Service Agency, we provide home health aid services, professional care, of course. So we work with everyone that's a part of the team, just to ensure that we can keep the clients safe and healthy in their homes. Our program focuses on social determinants of health, which will include addressing any issue that's not medical. A big part of our program here is having the LPN just to go assist them, taking them to the physicians, to their MD visit, just advocating for them. What we have is the luxury now with this program of an LPN that will accompany you to the doctor's visit and sit with you and help to advocate for you. So not only do you have a second ear and a second mouth to say, oh, remember, you have a list of these medications, or you remember you said to me when we made the home visit, because our program, we go in and we do an assessment in the home. So prior to us going to the doctor's appointment with the client, we would have made a home visit and we would have created a care plan based off of the assessment that was done and the information that was provided. And together we create a patient-centered care plan to meet the goal that the client needs to meet. The pressing issue or the chief complaint based on the doctor might be the medical concern. But when we go in, we realize that that medical issue is not the client's concern. The client's priority is, what am I going to eat today? How do I make this meal healthy enough? So now what are we addressing? We're addressing the food instability. So now we have to touch base on those two things. They confided in us as a care team. And now it's for us now to say to the client, this is something we have to address, but let us tell the doctor this as well, because it is connected directly to your medical condition. And in order to correct the medical condition and help you to not go into the hospital or not rush into the ER, we have to address these. Are you comfortable with us just giving the doctor enough information or letting them know? So that's really what we are.
This is incredible. And how you talk about that, we know that aging adults are looking for care where they feel valued, where they feel supported, where they can trust you. And to know that you are building that trust for that holistic evaluation, right? You're not just saying, can you get to your doctor, but is it sustainable for transportation? Do you have the right food that you can get, again, sustainably, week over week, month over month, housing? You're looking at those social determinants of health. And clearly what you're talking about is so person-centered. To be able to work with each person, respect their life experiences, help them live with dignity, access the benefits and entitlements that they have earned, as an older person in New York City, truly something that every person deserves. And if they can't do that on their own, or they don't have the network, you and your team are there to step in and to be that resource and to be that person for them. It gave me kind of goosebumps thinking about all the different ways that you are working with somebody, because you started out at the doctor's office and the doctor's visit and as an advocate, but it went so much deeper than that with the home assessment and really looking at their full life and all of those social determinants of health. So do you have any story or impact that you would want to share with our listeners?
We started this program in May of this year. We had our first client May 1st. This under our program or referral do have to come from the physician. So when we got the client, our social worker jumped right in. She followed up with the client's family members, and she communicated with the client, and she made a home visit. This client did not have a primary care physician or any physicians at all, because this client hasn't been out of the home for about 3 years. So when she went in, social worker did her assessment. But with the client, we realized that there's so much help that this client requires. Step by step, we started. We were able to connect him with resources in the community, which included a physician. We were able to get him a haircut, having a haircut without washing the hair, because this client has struggled with mental issues and was diagnosed with a mental condition. And with all of that and the isolation, this person had no will pretty much to do anything. He wasn't addressing his hygiene as he should. So the hair was a lot. The beard was really long and knotted. With the client caregiver's permission, we got an organization to come in to do the haircut. And as soon as that person got there, while my social worker was there, the person felt that they were uncomfortable and couldn't do the work. So they immediately gave us a story and left. Mind you, There was some deep cleaning that was required, but that was done. So the small things that were there was not a big issue. And there was just garbage bags, and we were able to take those out while the person was there. But point is, they left. So we had to regroup again and try to find another barber, which we were successful in finding someone. They went in, they did cut the client's hair and beard, and it was a brand new person. And from just that alone, we saw that it changed how that person saw themselves. We collaborated with the brother, which was a family member that's available, and we were able to he was able to purchase clothing, because again, there was no clothing there because he had lost a lot of weight over the 3-year period. So nothing really fit. So I was able to get clothing in. We were able to finally get him chairs. We were able to set up his environment where he could get home care. And he has really been doing so much better. We're still working with the client because there's a lot of things. It's a step-by-step process. And we look at our clients as an individual. Even though we can tick off the boxes of what we create, what the care plan initially required, as we go along and the client improves, there might be other issues that comes up that we say, okay, now this is going on, now let's do this. So we are able to reassess and recreate or update our care plan. So we're still working with the client. And there are some environmental portions. The bathroom needed to be sorted out. He was afraid to go and take a shower. So we looked into getting handrail. When they put in the handrail, they realized that the integrity of the wall, the tile was an issue. So we had to get that done. So we all work together though, with the family members, the doctors, my team. My team is a really great team. Trust me, we go above and beyond. And he has a really amazing aide. We were able to make a really good connection with the aides, the clinical team at the LICSA. So I go back to say it's a multidisciplinary approach that makes the effort, the work that we do come together and tie in. There was actually 3 different self-help programs that were able to work together to get the client to where he needs to be. I have many stories.
It's so person-centered. It's so compassionate.
Absolutely.
You are building trust,
Yes.
not only with the client, but with the client's family member, with the aide, right? With the barber. You're building trust with all the different people that are going to be working together for this one person. And you're also thinking outside the box, right? There's not a cookie cutter model that you're applying for each situation. You're really taking each person's life experiences and thinking creatively, innovatively about how to help them live with dignity,
Absolutely.
be able to live independently in their own home. And it's really a wonderful program, and it's a great example.
Absolutely. I guess it's the golden rule. Do unto others as you'll have them do unto you. And we've been told that ever since we was a child, but it sticks with me and it's something I do. I look at myself being in home care. I see myself in so many of my clients because anything can happen at any time. I realize too that people don't really want you to do things for them. And when they ask, it's because they need it. If there was one thing we have is pride. And with pride comes autonomy. And we can't take away people's autonomy. So we have to get them really involved. And when they have to do so, it eats away from them. That contributes to a lot of the mental health issues that we'll see among ourselves or even in our clients. Part of our program is finding resources in the community to address the mental health issues. In your mind, you getting better, what does it look like for you? And then we will help you to get to that point. So we don't take away anyone's autonomy. You need to have that control. We're just here to assist. But overall, what we try to do is to be memorable. And to be unforgettable, you have to be memorable. What does that look like? Is by providing compassion to others and being empathetic. Empathize with me. Put yourself in my shoe and provide compassion.
Well, I think that there is no better closing note than that. That is wonderful. It is compassion at the forefront of our care. Deneisha, thank you so much for talking to us today. It's an inspiring and uplifting conversation, and I hope that our audience also enjoys learning about everything that you do. So thank you for your time. We appreciate it.
Thank you so much. It was a pleasure.
Thank you for listening. If you're interested in any topics, you can leave a comment or find us on Instagram, Facebook, LinkedIn, TikTok, and Twitter. Don't forget to subscribe to our channel. Hope you all have a great day, and we'll see you next time.